Hi everyone, it's Lisa Moeller with MedMark Media and Dental Sleep Practice Magazine, and welcome to a supersized edition of DocTalk Dental. I think this is quite possibly our biggest guest literally and figuratively ever to sit down to talk sleep with me. With nicknames that include Superman, the Diesel, Big Aristotle, Big Cactus, or make that Big Shactus to us Arizonans, he is undeniably one of the most recognized celebrities on the planet. He may have won 3 NBA MVPs, but today we're going to add an MVS, Most Valuable Sleeper, to his long list of accomplishments. With us to talk candidly, as only he can do, about his personal issues with sleep, why he needed to get more of it, and how he sought the help he needed to treat his sleep apnea from one special dentist. Welcome the one, the only, Shaquille O'Neal. So Shaq, thank you so much for joining us today on DocTalk Dental. This is an amazing privilege. Thank you so much.
Thank you.
This is awesome. So, okay, you have so many different, I have to ask this first. You have so many different nicknames, okay? You've got Superman, you've got the Diesel, Big Aristotle. So which one is your favorite nickname, I have to ask, and why?
I think the Big Aristotle.
Where did that one come from?
I repeated an Aristotle quote one time. So I like reading quotes. I think you can learn a lot from a quote. You can learn a lot from an individual, and you can see what he was thinking. Like one of my other favorite quotes was by General Dwight Eisenhower. The greatest leaders are the ones smart enough to hire people smarter than them. After I read that quote, that's how I started handling my business affairs.
Right.
Because I don't know it all, but I like to know people that do know it all. For example, when it comes to sleep apnea, Dr. Greenburg. Yes, he's a man. I've already had a little bit of experience with the sleep apnea. I was part of a Harvard sleep apnea study. My good friend, Dr. Brad Seisler. Dr. Seisler, I don't know if his name is Brad, but Dr. Seisler. So did a lot of research with the sleep apnea. Let me know that I had severe sleep apnea. Let me know the warning signs about it. But guess what? I'm Shaq. I didn't care anything about that. It's not going to happen to me.
Right.
I'm one of the world's greatest athletes to ever play the game.
Absolutely.
I'm sexy. I look good. I do anything I want.
I agree.
I'm not listening to that. But, as you get older, stuff starts to happen and, things stop working. And,
uh-oh.
And you have to...
That's a different show.
No, I'm just I'm pointing at my knees. And you have to go back. So one day I'm on my Instagram and some little guy sent me a real brash message. Do you want to die? I'm like, what? So you know me, I thought the guy was threatening me or something. So what you talking about? Dr. Greenburg, and he says, you have sleep apnea. I was like, how you know that? He's like, I can tell. So we started talking and went to his office, and again, he reiterated heart attack, high blood pressure, hypertension, all that good stuff.
Right.
And he said, I have a device to help you because I have all the toys, the CPAP machine, but I don't use it all the time.
Right. Well, not many people do.
Yeah, and I know for a fact that I stop breathing, I think it's 72 times per minute.
That's serious.
Per minute or per hour? Yeah, so 72 times per hour is very serious. And every now and then I'll wake up like, so I'm 47, 6 children, starting to come on the other side of the hill. So, the D word always scares me. So
I know.
So to prevent it, I'm starting to do things more better. So I've been wearing a zebra for about 1.5 years now, and basically it just stops your tongue from going back forward. I love sleeping on my back.
Yeah.
So when you sleep on your back,
big snoring.
It falls back and it blocks the airways. But with this device, it holds the tongue down.
Like a seatbelt for the tongue.
And when I wake up, I feel I'm able to work out in the morning. Usually I wake up and be so tired, it helps me make an excuse. I'll work out later. I'll do this later.
Yeah.
I won't do it now, but now when I wake up, I'm like, let me go get on the bike for 40 minutes.
You actually dreamt probably.
I actually feel pretty good.
Yeah.
And now, I'm starting to do other things right. For the first time in a long time, I lift my little shirt up. I always had a 4-pack, but now it looks like 4.8.
Oh.
Yeah, it's coming.
Wow,
it's
nice.
Coming. Yeah,
That's what happens when you get sleep.
So you get good sleep, and I always try to get 6 or 7 hours anyway. But with this thing, I've been getting some some nice REM sleep. Some
Yeah.
nice 6, 7 uninterrupted. And then when I don't wear the mouthpiece, I got to use the bathroom 90 times. Like, geez, what's going on? When
Yeah, that's
when
typical.
I put the mouthpiece on, I'm like, la, 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 la.
And you're sleeping through the
I'm sleeping
night.
all night. Dreaming, beautiful dreams.
Yeah, and your bed partner is happier person in the morning as well.
I have no idea what you're talking about. I had a dream that I married the Queen of England and I became the King of England.
Oh,
And then I woke up with a British accent. It's getting better. It's getting better.
I like it. Well, your son Sharif kind of outed you and snore shamed you on social media. So tell us about that.
Well, listen, I work hard and they caught me sleeping and I snore. Everyone knows I snore. I'm a heavy snorer.
Yeah.
You know, I think I read, and they say if you have a 18-inch neck or above, you're probably going to be a snorer, and you're probably going to have some type of sleep apnea.
Mm-hmm.
So my neck is 21 inches, so I've been a snorer for a long time.
Yeah.
So they caught me, and Dr. Greenburg, after he saw that, see, I told you, you need to come back to my office and get the mouthpiece. I told you. So he's like
He's resilient.
yeah, he's like a guy that never stops.
He doesn't.
And he actually tried to fight me one day too.
What?
Oh, he tried to beat me up in his office.
Why?
He was like, I don't want the mouthpiece. And he was choking me and putting it in.
You're gonna have it no matter what.
No, he's a great guy. I really like him and respect him because he cares.
He does care.
You know, a lot of people, including myself, I didn't care. I'm not, okay, well, whatever you say, sir, it's not gonna happen to me. I'm good. But when you start going on the other side of the hill, you start to, feel certain things. So
Absolutely.
that's something that people should definitely pay attention to. And I'm here, and Dr. Greenburg is here. We're here to bring awareness to it because,
Absolutely.
especially for the bigger people. If we stop breathing at night, our heart's gonna have to work double and triple time. And sometimes it can handle it, sometimes it can't. But if you keep doing that over a course of time, one day your heart's gonna say,
bad on your heart.
I can't handle it no more. I gotta go. So.
Yep. Well, big, small, young, old. I mean, it doesn't discriminate really.
Right.
And it's an epidemic and a deadly disease, and it's just bringing awareness for DSP has just really been my heart and what I've wanted to do since I was diagnosed with sleep apnea 5 years ago. And I completely fell out of bed one morning at 2:00 in the morning, and because I had stopped breathing.
You fell out of bed?
I fell out of bed because I had every symptom of a heart attack.
Oh.
I literally stopped breathing, and my brain didn't wake me up until I fell. It was very scary.
Now you just scared me again. Now I got to really, really worry about it.
Shaq, you have to wear it.
No, I wear it. I do. I wear it.
Okay.
You know what? I'm not going to lie to you, to the people. Out of 10-day span, I wear it 8 out of 10 days. And the reason why I don't do it like the other 2 days, so let's just say I come in and I work out 6, I got an 8 o'clock flight, I won't wear it for a 2-hour nap. Because the 2-hour nap, I'm asleep, but I don't even know. Like I'll come in and say, all right, let me watch Netflix. And then the car going to be here at 8, and then I'll just,
Right.
that's the only time I don't
I'm
wear
guilty of
it.
that as well.
If it's I'm going to bed, I got to do something in the morning, it's rinse it off, turn it in, hand light out, contract guy, can't call, go to sleep.
Right.
That's how you find me wearing my beard. And that's why I'm done like that.
Well, I mean, that's how it is. But it's a lot more convenient than a CPAP. Did you ever try the CPAP or?
Yes, I did.
And what was your experience there?
It's just loud.
Yeah.
I'm the type, after working all day, when I come in the house, I want complete darkness and silence. I have puppies, and they're disciplined that when daddy goes to sleep,
Everyone goes to sleep.
Don't even wag your tail.
Oh.
Yeah, I want complete silence, and I live out in the country. Like, I don't mind hearing nature sounds like whoo, whoo, but any earthling sounds or people sounds, it won't be good for you.
Gotta be quiet.
So with the machine, it was.
The air.
Yeah,
Mass leaking.
Yeah, so even though I'm tired, when I put it on, it'll take me another hour to get to sleep. And then when I talk, I sound like Bane. With the place on my face, I sound crazy. So I'm just like, I don't like this.
Yeah.
So I'm glad Dr. Greenburg harassed me in my DM.
Absolutely. I call it highway to the danger zone.
Highway to
Right?
the
Have to
danger
put that
zone.
mask
Yeah,
on. Yeah. It's not a good look. Not a good look. So you're known for so many accomplishments in your life. So now you've been treated for sleep apnea. Why is it so important to you now to spread the word on sleep apnea awareness?
One day after retiring from basketball, I gave my mother a lot of gifts. It's my way of thanking her. And she said, I don't want these, baby. I love you very much. What have you done to brighten up somebody else's day? And it hit me. That's my mission after I retire. Make people smile, make them happy, let them know I care about them, let them know I love them. So if this is something that I could help out with, I'd be happy to help out with. A lot of times, you need that I don't want to say higher voice, but you need that upper voice to tell you. Because I didn't pay attention to it until I heard the upper voice of Dr. Greenburg. I was part of a study. I was part of a Harvard study.
Yeah,
the
that's
tubes
big.
On me, sleep at night.
That's lovely,
look,
isn't it?
He gave me all the warnings, and still I was like, thank you, great job, boom, boom, boom. And I still never used the CPAP, never used anything. And then I heard the higher voice of Mr. Greenburg, who brought me in and showed me some more stuff. And now I'm hearing the higher voice of you, that you had all the symptoms of a heart attack, and if you wouldn't have fell out the bed, we might not be doing this interview today.
Might not be.
If I
Thank
can be
God.
that higher voice to tell people and, help them be aware, that's what it's all about. Like, people ask you, like, you do a lot of stuff. It's just like, it's not that I'm doing a lot of stuff for me, I'm doing a lot of stuff for you.
Right.
Right?
Right.
So,
You're a giver.
I am.
You're a
And
Pisces.
People ask me all the time, what do you want to be remembered for? And my answer is simple. Just want people to say Shaq was a nice guy. It's enough. He made this and he did that, he invested in that. I don't care about that. Nobody cares about that. I want people to say, I met Mr. O'Neal. He was nice to my kids. Period. End of story. Close the book. Not, I met a guy. He got 4 championships. He got 60 cars. He got 20 houses. Nobody wants to hear that. There's too much of that going along with these celebrities, and I don't want to be in that category.
Right.
I want to be Shaq's a nice guy. Period.
I think everyone already thinks that.
I hope so.
Mission accomplished.
Thank you.
Yeah. So let's talk about, while we're on the subject of Dr. Greenburg, we should just bring him on, sit with us and ask him some questions.
I can do magic. I am Kazam. Here he is right here.
Oh, there's Dr. Greenburg.
Yes, he just floated in.
Welcome, Dr. Greenburg. Nice to see you. Thank you for joining us.
Shaq.
He's not that nice, trust me.
He is a nice guy.
How old are you, if you don't mind me asking?
Well, you're really going to ask me that?
No, it's just,
How old do I look? I'll give you that
married.
one.
You're 30, you're about 35, 36.
I love you even more.
You're younger or older?
Older.
Okay, so
Are you just being nice?
No, you look fabulous.
Thank you.
Remember that Tom and Jerry cartoon? Did you watch Tom and Jerry?
Yeah.
When the little mouse, who was the mouse? Mouse was Jerry, right? When Jerry brought his cousin in that had the hat, little Spike, and Spike blew up his fist and he knocked Tom out, that's him. He looks nice, but he's a mean son gun, I tell you. No, he's a good guy.
He's just helping people.
He cares.
He's helping people with sleep
He really
apnea.
is.
And we're so happy to have you. Thank you for joining us. So you're from Los Angeles.
Yes.
And you are the founder and the owner of Zipa and Sleep Certified.
Yes.
So tell us how your journey came to be that you met Shaq, and how did you guys connect?
Well, I could relate very well to what Shaq's mom said. What have you done for others? And as a dentist, I was helping a lot of people, but there were a lot of great dentists out there. And I saw the issue. There's 40 million Americans with sleep apnea. 90% are untreated. There's 100 million people who snore. And that means there's another 40 million bed partners impacted by those who snore. So you're talking about a huge
My husband
number
was
of
one
people.
of them.
Yep.
He's like, thank you so much for getting treated. Thank you.
Exactly.
It's crazy.
So you've got so many people. You've got almost half the country, okay, that's impacted in one way or another by somebody who snores or has sleep apnea, with all the impacted issues they have. And just like Shaq said, okay, it's not going to happen to me, or it's not a problem for me, it's not a problem. And they're not aware the issues are as great as cancer. Okay, if somebody tells you have cancer, you don't go, how much does it cost to get it fixed? Or I'll get it fixed next week or next month. You just go, you stop everything and you get it handled.
Right.
Well, the impact of sleep apnea, strokes, heart attacks, You know, the correlation with Alzheimer's and such, and the fact that you've got a 4 times increased risk of cancer as well now, the studies are showing. This is no joke. Yet, so many people were not being treated, and I knew that this gave me a reason, a passion, to change the planet for the better. And not just in the US, but worldwide and global. And I just like Shaq said with Eisenhower, I needed a voice bigger than mine. You know, people look at me and they go, I'll listen to you a little bit, maybe not. When Shaq talks about it, okay? When Shaq says, people listen. And to me, it was like, Shaq's always been about positive things, about fun, about good. And to be able to have a personal impact on him and then also on the planet. You know, there's so much divisiveness going on in this country, in the world.
Yeah.
And to be able to do something really positive, good, proud, that makes people wake up in the morning in a good mood. You know, if we don't get a good night's sleep, we wake up, we're grouchy. It's like when we pull an all-nighter. We snap at people. We're not very nice. We're not very friendly.
No.
But we get a good night's rest. We're patient. We're understanding. We're giving. Our nature is very different. And then on top of that, we're also adding years to people's life. So quality of life and years to your life. I mean, that's why it's easy for me to get up early in the morning every morning and be impassioned. I can't wait. Well, I don't wait for Monday to come. I'm working Saturday and Sunday as well.
Yeah.
But so to bring in a spokesperson, someone who is so fantastic like Shaquille, to help change the planet for the better. I couldn't think of a better spokesperson, but I had to get him better first. He had to be a believer. And in doing that, you know, I'm ecstatic. I know where we're going to go from here and what we're going to do and how we're going to change the world for the better is just, I mean, I love it.
That's awesome. I'm so proud of you guys. I mean, I'm like, personally, this journey has been, you know, really amazing. And like to have Shaq involved, I think you're going to bring so much awareness, and you guys together, it's going to be amazing. So with an AHI, you said of 72, was it? So that's very serious. So you got on it right away. So you made a custom appliance for him, and
Yes.
which he's wearing every day. And I get it. So tell us what is your vision for Sleep Certified and with Shaq on board, and that's really the area where you're reaching the doctors most, right? ZIPA is the public, Sleep Certified is more the doctors, and educating them on sleep apnea.
Correct. Well, part of what's happening and part of the vision is we wanted people to become aware of the issues of snoring and sleep apnea and how snoring will lead to sleep apnea. I mean, actually, 40% of the people who snore have sleep apnea. So they've got a real serious issue here. We're educating the public, creating that demand. Well, when we have that demand, all these now patients need to get treated properly. And it's very important that they get treated at the highest level. And so how do dentists get trained and treated at the highest level? We created Sleep Certified, which is an online educational platform that not only trains dentists, but their staff, how to treat sleep apnea at a high level, and creates 9 levels of certification. So the consumer, we can be very transparent to the consumer on the level of expertise, not just the dentist training, but also their 5-star reviews. So how many reviews? How do the patients feel that their treatment was? So that people can go online, they'll go to our Sleep Certified map, and they'll see what level of training that dentist has achieved for treating sleep apnea patients, and they'll be able to choose the best dentist for them.
Right.
And so that's the whole goal, to be able to make something very inexpensive and accessible to dentists and their staff, to be able to get that kind of training so we can bring that to the dentists that can actually now handle this big influx of patients they're going to start seeing.
Well, it's got to be done right. I mean, if they're going to do it, they need to do it right, and it shouldn't just be the flavor of the month for a dentist to, you know, hey, I'm going to take a little course, a tiny little course, and I'm a sleep apnea expert, right? So that's awesome.
It's a commitment. It's
Yeah.
a long-term commitment.
So with that said, where do you think the future of dental sleep medicine is going,
It's incredibly exciting.
knowing how it is now?
Oh, it's, you know, there's so much work to be done. You know, as I said, 40 million people with sleep apnea. The number is growing because the baby boomers are getting older, the obesity rate is getting worse, and so that contributes to increasing snoring and sleep apnea issues. And so therefore, with all this going on and now this awareness that Shaquille and I are able to do and bring to the public with the television ads and the radio ads and things that are going to be coming forth, it's incredibly exciting to be able to now know that these patients are going to want to get treated and to get these dental offices very busy with sleep apnea patients.
Right. So if they're already treating sleep apnea, how do they get involved with Sleep Certified?
So whether they're treating sleep apnea or not, they should go to the website sleepcertified.com, and they can easily get on board there. If they're already treating sleep apnea, especially as a high level, we have our level 8s and 9s that we're working with on programs for them to specifically get referrals to. And again, they can contact us directly through sleepcertified.com, and we'll be able to get them on board with it. But no, we're incredibly excited. This thing's is about to explode. In a really good way, positive
absolutely,
way.
absolutely.
You know, it's just, that's the part that excites me. This is about changing people's lives. And when you can do that to this kind of a degree,
It's huge.
it's a legacy.
Absolutely.
And so I can't think of anybody better than Shaq here to go on this journey with me. And to make
I
that
can't
happen.
either. I mean, when I heard about it, we put a press release out on it, and I was like, yes, that is awesome. Because really, not a lot of celebrity want to stand up and say, hey, I have this, or bring that to people's attention.
I'm not a celebrity.
Really?
No.
Oh,
Just a young kid that listened to his parents.
just a regular guy,
A regular guy.
just getting through in life.
Celebrities are crazy. Charles Barkley's a celebrity.
Wait, he's in the building today, so that'd be funny if he popped on set. So thank you so much for joining us today. This was a pleasure, and I'm so excited for you guys, and I'm excited to be on the journey with you. And I hope down the road we can get together again and have another chat.
Yes, we will. Thank you.
Okay, thanks, guys.
Thank you.
So that's going to do it for another special edition of DocTalk Dental. I can't thank Shaq and Dr. Greenburg enough for taking time out of their busy schedules to join us today. It is truly all of our missions to help educate our dental audience on the importance of properly diagnosing OSA, what to look for in breathing airway issues, delivering proper treatment, and just how critical your everyday role is in helping to save patients' lives in this country. Join the team, become the MVP of your practice, and let's put some serious Shaq-style slam dunk on this epidemic. I'd also like to thank this episode's sponsor, Sleep Certified. For more information on Dr. Greenburg and his company, please go to sleepcertified.com. And as always, to find info on everything dental sleep, please look for DSP Magazine at dentalsleeppractice.com. Thanks so much for watching. We look forward to seeing you all back again on our next segment of DocTalk Dental. Until then, keep making our world smile. Take care, everyone.